you sick of feeling numb in your fingertips or maybe even your whole hand or arm? Some people even feel like it feels like little ants crawling up and down your hands or arms. Other forms of numbness and tingling, those things are very common problems that we see in this practice and are very fortunate that we're able to provide a very effective and safe solution. So I'm Dr. Norris Goldberg. I'm the owner here at Chiropractic Corrective Care in Louisville, Colorado. And I'm very fortunate I'm able to help people with neuropathies and different types of numbnesses and tinglings related to the spine on a daily basis, quite honestly. So what we see is that when people get degeneration in their spine or even just a simple misalignment, it can put pressure on and irritate the nerve, right? So when you put pressure on a nerve, just like when you hit the old funny bone or your ulnar nerve here, you get that tingling zap that goes up the arm there, right? But when your neck is twisted and rotated, what it does is it puts pressure on the nerves that come out through these little holes right here, right? Now, eventually it can turn into a bigger, more chronic problem with advanced degeneration and compression of the disc or arthritis around the intervertebral foramen right here. These are serious problems, but can oftentimes still be helped or alleviated with neurologically based chiropractic care. And that's really what we specialize in here at this office at Koru. So with gentle and specific adjustments, we're able to open those spaces up, move those bones apart, and allow the pressure to come off of the nerve. What I find is probably the vast majority, I'd say 80% of people, even if they have arthritis, are able to experience relief from their numbness and tingling. Now, in other cases where maybe it's very severe, very acute pain, the odds go down a little bit, but oftentimes we're still able to pull people, I often say kind of pull them out of the grave, because I mean, just this week we've had people come into the office where they can't even stand up straight, their sciatica is so bad, or their arm and hand are so numb that they're really not even using it consistently anymore, or at least just notice a deficit. Maybe they're grabbing things and they feel like they can't get a nice strong grip, or they just don't sense where the fine motor touches in the hands. So it just feels like, your hand's constantly falling asleep. A lot of times people will tell me they're experiencing this while they're driving with their hands up or working at a computer. Of course, a lot of people are doing that these days. And with a focus on corrective care, where we're really trying to not just fix alignment, but we're really actually trying to restore your posture and the function of your spine and your core muscles, we're able to see fantastic results with numbness and tingling. In fact, that's oftentimes one of the first symptoms that goes away, because usually it's also associated with some neck pain or low back pain. A lot of times there's chronic muscle tightness. Maybe even we can discover like functional imbalances. Certain muscles are really tight, other ones are really weak. So we want to address that with chiropractic corrective care. And again, with very gentle and specific adjustments. So we don't actually do the more traditional chiropractic approaches in this office with a lot of twisting, cracking, and popping. We use a more specialized, advanced method. I use a combination of techniques, including NUCCA, the National Upper Cervical Chiropractic Association, and the Pierce Results system. So with Pierce, we do a lot of drop table adjustments. We're working on the entire spine from your head to your hips. Sometimes I have to do extremity adjustments, kind of loosen up different joints, get them working again as well. And then we oftentimes are prescribing corrective exercise to make sure those adjustments last. They actually stick and stay in place. We want to actually strengthen and stabilize the spine after we do an adjustment, right? So that's where my background as a former strength and conditioning coach really helps a lot. I have a vast understanding of both function and performance when it comes to not just the spine, but the entire body. Oftentimes, if we can get this upper neck misalignment corrected, whether there's a lot of head tilt going on and rotation. So a lot of times what that will do is we'll compress these facet joints, which again is right where that nerve is coming out. And so many times we'll see people who are experiencing numbness and tingling and don't have arthritis. And just doing a couple adjustments can oftentimes get them complete relief, all right? So if you're suffering from numbness and tingling, if you're tired of just feeling icky, in your hands or your feet, wherever it may be, and you feel a connection to the spine. A lot of times it is associated with some neck pain, again, or low back pain, maybe some shoulder stiffness. And what our patients experience is not just less pain and less numbness and tingling or pins and needles, but they're also actually experiencing better sleep, because it's not bothering them throughout the night. They're feeling more restored. They're having better energy. They have more range of motion and durability and flexibility in their spine. So they're able to just get back to the activities that they love doing the most without any fear or repercussion of having a big flare up, right? So if you've been dealing with on and off numbness and tingling, or maybe even daily numbness and tingling, and you've been wondering what a good solution is besides drugs or maybe trying to avoid surgery, we would love to help you out here at Koru Chiropractic. And all you have to do is check out our website, give us a call. If you're watching this video and you find it helpful, give us a thumbs up, and hope to talk to you soon.